Hi there, it's Robert Redfern, and it's welcome to my Thursday newsletter. This week I've got some quite interesting news, and I've also refreshed some of the old stuff from before. Things change all the time, and we get a different perspective. But the first interesting thing is that we now know that COVID-19 has been shown not to be as dangerous as the governments of the world were led to believe. In fact, so few people are dying at the moment, certainly in the UK, that the only scare tactic the governments have got left to carry on terrorising us is with the so-called number of cases. These are being reported daily as though it's some mounting serious crime or meaning, and when in fact the PCR test which they do to get these is mostly fictitious information. Who says so? Well, the inventor of the PCR test, Kary Mullis. Kary Mullis is a Nobel Prize winner of chemistry. And this person designed the PCR test, but they said it should never be used, never be used for diagnostic purposes. Now, the test amplifies a bit of virus and DNA, and a degree of amplification can show a positive or negative result, whatever that means. It can therefore, though, be, according to Kary, be falsely used to show that the disease is on the increase or waning. So the governments could choose to show high levels of infection before a vaccination and low levels afterwards. But it's a gamble whether they are choosing to increase or decrease the figures. So never agree to have a test unless you definitely have symptoms, and then you want to know. But really, if you've got symptoms, they really shouldn't even be bothering testing you. So the test is not. It can be fictitious, and it really depends on what they want to see or which way the wind is blowing, as we say. This is now the flu season, and the flu season is already going in the UK, and many more people are dying of flu compared to COVID-19. So we have a flu season, not a COVID-19 season. However, this can all change once all of the at-risk people rush out to get their flu vaccination. Well, what's that got to do with it? Well, it seems that those that have the flu vaccine, I have mentioned this before, are more prone to getting coronavirus. That's what the stats say. There's lots of people for many years have known the flu vaccine can actually generate or cause the flu. People say, "Oh, I had a flu vaccine," and then a week later I got the flu itself. But it's actually studies show that it actually causes respiratory diseases, even in children, according to studies. And that's double-blind crossover studies, not some opinion study that most of the COVID-19 stuff is. The difference is, though, that children or anyone under 40 don't generally die from flu or COVID-19 diseases, but they do get respiratory problems after they've had the flu vaccine. I had the flu once. I think it was in the winter of 99, 2000. I can't remember whether it was before Christmas or after Christmas. But obviously I would have had low levels of vitamin D3 then because I wasn't taking D3 20 years ago. But for at least 3 days, I felt absolutely dreadful and couldn't do anything. I just lay on the couch during the day and being waited on by my dear wife. But after 3 days, it passed quickly and I recovered. So at-risk people who are low in D3 do die from the flu vaccine and subsequent infections, but they've got to be at-risk people. So what's not admitted, though, by anybody, doctors won't say it, is that having the flu vaccine is directly related to the number of deaths from COVID-19. Now, I've got a little slide here which I'm going to show you. Back to being technical again. I hope you don't mess it up again this time. There we go. Yes, I'll take me off. and put the iPad on. There you go. I don't know what you're viewing it on. If it's on a mobile phone, it won't be as good as it could be. But anyway, you can see, looking at this list, it's not absolutely proportional, but it's fairly close. The more people as a percentage that had the flu vaccine in any of these countries, going all the way through Europe, the more people died of COVID-19. That's crazy, isn't it? Now, I don't know who actually put this together, but it's a factual piece of information. Obviously, the pharmaceutical industry and the doctors that are COVID fans don't really want to display this. But the more people that have the flu vaccine, the more people die from COVID-19. The correlation is correct anyway, because the study with the flu vaccine being given to children caused respiratory problems with those children. As I say, because they have strong immune systems, they really wouldn't die. But the facts are there, and so what can I say? It really is a fact that it's a correlation, and the same as I always recommend people don't have a flu vaccine, and I also recommend they don't have a we haven't got a COVID-19, so I'll keep off that subject. But don't have a flu vaccine, have vitamin D3 in high dose, and then that'll keep you safe generally anyway. Obviously, you've got to have a healthier lifestyle, because that's what causes people to be at risk. Nobody that has a super healthy lifestyle is at risk. It's just a fact of life. So it would be interesting to get the figures from other countries around the world, or particularly countries such as Hong Kong, South Korea and Australia, because they've got very low numbers of death from COVID-19. And I'd like to see whether they have had flu vaccines in such high numbers, and certainly their levels of vitamin D3 in the blood. But it could be, you see, that Hong Kong, South Korea, Australia have got naturally high levels of D3 in the blood, so which protects them. So D3 has been shown to help save lives of those with COVID-19 and flu, and of course prevent it. So all this evidence put together could be final proof of the efficacy of D3 to prevent deaths from disease. And that's all disease, of course, because it's also shown on things like prostate cancer and breast cancer. But we have a problem. We have the title of this week's newsletter, which is at the top when you get it. It says ill-gotten gains, a little play on the words, because the pharmaceutical industry only gets gains when you're ill, and the pharma masters and the healthcare system make small fortunes from flu and soon to be COVID-19 vaccines. In the UK, doctors are paid to get as many people vaccinated with the flu as possible, and they've never had a flu vaccine that actually is proven to work with double-blind crossover studies. Remember I mentioned before that they gave flu vaccines to children, and it literally caused a huge incidence of respiratory problems. So it didn't protect them. Not only did it not protect those children, it caused problems. And that's why they could never do a double-blind crossover study on adult people, because it would show that it made them more ill. So that's the fact of life. Take it or leave it, listen to doctors, and you have all the problems of the deaths. Listen to the scientists with vitamin D3, and you'll see that you have many, many times less deaths. And of course, the craziest thing on this planet is that the pharmaceutical industry, and in the UK, I don't know if it's the same around the world, but even the doctors and anybody that gives you that vaccine is completely immune from any liability from the side effects. If you die the next day from it, doesn't matter. They have got total immunity. from any liability, which is, I think, it's a crime actually. But I think the whole thing is a crime. But let's not get too strong on this. Strangely, in almost all countries in the world, all of this vitamin 3 data will be kept out of sight. It's available. I go on the internet, I go on to YouTube, and I see scientists giving all this data on D3. But you don't hear it in the corporate media. They never openly discuss it. Although I'm going to mention that there are some people, but you know, pharma and the universities are having billions thrown at them by panicking politicians. So you can see if they turn around and said, oh, guess what, folks? We've just found out D3 will prevent COVID-19 and flu and reduce the deaths by many times over. They're not going to get the billions that have been thrown at them by panicking politicians. See, the politicians are panicking because they're in a state of terror themselves, because they actually believe the Gates gang and the World Health Organization and the pharma medical cartel. So you can understand that they're going to, panic, really, because they're not sure. All right, they do hear all sorts of things going on. Our Prime Minister, called Johnson, he had a conversation with the Swedish health minister that had such a success there with not locking down and not doing anything, and it's really almost over completely there. But he's not. He's just too scared to do anything. So it's weak-minded politicians and evil-minded pharma medical cartel and the Gates gang and the World Health Organization. So it's a stated aim of the Gates Foundation as well to reduce the population of the world. I don't, you may have seen it, but if you want an explanation of everything I ever say, there's a fantastic video called Plandemic Indoctrination video, and there's a link in our newsletter which takes you to our site, actually, not through to because it's banned, of course, everywhere, but we've got it on our website. So if you want to, it's about an hour and a half actually, so don't sort of just think you can just dip in. It's a big story trying to explain the evilness of these people and what they've done. So watch it to the end, because you'll be absolutely gobsmacked to see what Bill Gates says to camera about what he's doing. And while mass dangerous vaccines may or may not be needed, and I cannot absolutely say whether they're needed or not, because all I can do is go by the studies, and the studies show they're not needed. In principle, I think it's a bad way for anybody to try to improve their health by having drugs anyway. And when nutrition and a healthier lifestyle will clear it all up. So, essential facts. COVID-19 is just another coronavirus epidemic. They come round occasionally. There's been about 6 of them. And tests are well known that if we look after our health, it's not a problem at all. And it could be that this one has been altered at the Wuhan labs in China. I don't know. People say this, but the results are clear anyway. It's nothing to be feared by healthy people. And if you're not a healthy person, then you have to obviously even if you started now taking vitamin D3 in high doses, that Dr. Fauci, the evil guy in America, he admitted that he takes 6,000 IUs of vitamin D3 a day and 2,000 milligrams of vitamin C every day. He knows very well how good it is. But of course, he still wants you to have a vaccination because they're making billions at it. So germs are not our enemy. In fact, over half our body, I've said this before, and it's not, it's an absolute fact. Over half our body consists of virus, bacteria, and microbes. We are only less than half human. but we can't survive with all these microbes because over the years they've become part of our body, thousands, hundreds of thousands of years or longer. Surprisingly, one bacteria you've heard of, E. coli, which everybody goes, oh, E. coli, food poisoning, people rush to hospital. E. coli we can't live without in our digestive tract. There is a form of E. coli which has gone bad, and I think it's very difficult to track it down, but I think this bad E. coli that causes food poisoning is a toxic form, probably from intensive animal farming and giving animals, because you may or may not know, they absolutely douse the animals with antibiotics, which is why antibiotics are failing. And they douse them so they can just get the animals to grow faster and have less problems with them. Anyway, number 3, over half our body consists of resident germs, and these are essential for our good health. We have to look after them, and we have to stop feeding them sugar, because when we feed our resident bacteria germs sugar, they go crazy and our body becomes unhealthy. So no sugar, no carbs, no bread, pastry, biscuits, breakfast cereals, rice, potatoes, parsnips and pasta. Stick to vegetables, fruit, nuts, seeds, beans and fish if you eat fish. To get healthy, these are the 4 things. Consuming really healthy foods, not a balanced diet. Don't listen to doctors. They just say, oh, eat a balanced diet, you'll be fine. You will not, because there is no meaning in the word balanced diet. Balance between good and bad? No, I don't want any bad food. I only want really healthy foods. So call it really healthy foods. Excuse me. So it's very difficult that most foods, even organic, no longer contain all the sufficient amounts of nutrients. So supplements are always needed. Some supplements, it's a fact. It's not, a theory. And I could go through all the ones that are not in your food, but that's all in my books anyway. So when our body is exposed to sunlight, it manufactures critical nutrients such as vitamin D3. There are some foods that's got a small amount, such as mushrooms. Could be why mushrooms are good for your health. 5 mushrooms a day apparently help you live longer. But you generally don't get enough D3. You certainly won't get it in the winter. You won't get it if you go around, completely covered up against the sun. I see children on the beach and they're completely covered head to toe from the minute they go on. Now, it's fine not having too much, let them play, in a swimming costume for an hour, something like that. Then cover them up, but because better to cover them up than use these toxic sunscreens. But they have to get some sunshine. You have to get sunshine, but it's better to get a supplement so that you know for sure you've got it in your body. You also need to consume probiotics, bacteria, because the healthy bacteria are needed to help your own bacteria, because over half your body is bacteria, virus and fungus. And so they also help to kill any harmful germs that enter the body through food in the digestive tract. You need to get oxygen. Oxygen is the powerhouse for your whole body, from every cell in the body. And by breathing correctly, you get the maximum intake of oxygen and exchange of carbon dioxide. It's essential for a strong immune system. The immune system uses oxygen to produce hydrogen peroxide, which kills any infections in your body. So the more oxygen you've got, the better the hydrogen peroxide, and the easier it is to kill any infections that get into your body. Proper oxygenation can only happen when we're walking, standing or laying down. When we're sat down, we cannot breathe properly, and that's again a fact. So you sit down as little as possible. These new epidemics come round, they have always come round, and as long as you get healthy, yes, there will always be some people who are really unhealthy, but we can't live our whole lives being in lockdown for people who are unhealthy. Otherwise, nothing will ever work in the world, in fact. So when they come round, as long as you have had your nutrients, as long as you've got your D3, your immune system will build strength against it, and it will not be a problem the next time. I told you 20 years ago I got the flu. I've never had it since, and I never will. I'm 74 now. I'm supposed to be an at-risk person at age 74, and I'm not. So there are people at risk, and it's a fact of life. They may have cancer treatment and all sorts. Although in Britain, actually, it seems they've just been sent home to, well, die. Really, it's a terrible thing because they're not being cared for, and they really should be cared for in care homes, hospitals, or even hotels for that matter. But they should be given vitamin D3 and vitamin C, and it's not happening. So not only are they at risk, they're putting at greater risk because the doctors are refusing to give the specific nutrients they need. So people at any age, obesity, bad diet, bad advice, lack of support by the health authorities, that's the wrong advice. Groups who just can't afford to have nutrients, they do need some help. I told you before, when I was born, I was given vitamin D3 liquid and vitamin C liquid for the first 9 years of my life. Why can we not do it for all children? But especially children from the poorer families, they really need it, and the parents as well. But the pharmaceutical won't allow it because they don't want people to know it's nutrition that keeps you strong and healthy. They want you to have their drugs, drug pushers. Anyway, these groups can never be fully protected, so we have to protect them, and we need to push with the politicians. So the less you and your family pay attention to 4 critical, the more at risk you are. It's whatever you have to plan to get healthy, and the more you stay away from other people during epidemics, the weaker your immune system will come, because we swap these germs between us. And don't even get me on the masks, because the masks don't work. Actually, they're proven not to work. There is no proof they work. It's a theory that they have come up with that it works. I think it's to terrorize you, but that's, I can't know exactly why, but I can guess. And children should never wear a mask at any age. It's just disgraceful. They can't pass anything on. And anyway, the older you get, the more essential it is to pay attention to looking after your health. The older I get, as I say, 20 years ago, I got flu once. I wasn't looking after it as I am now, and I can't get flu now. But we really have a World War III situation, because the establishment, politicians, the corporate media, the pharmaceutical medical cartel, they've declared war on the populations of the world. And it's all countries. And the excuse is it's for our own good. They're liars. Absolute liars. And they've either brainwashed our politicians or bribed them. And politicians, you may or may not know, but are easily bribed. And it's been known ever since politicians existed, from Roman times or even Greek times. And senior medical people are also, part of this scam. I know that because there's so many scientists, so many Nobel scientists saying what I'm just saying now, that this is all wrong. But of course, nobody's taking any notice of them, because they're not part of the bribery of what's going on, or they're just terrorizing they're not very bright in their minds, the politicians and the senior medical people, and they're easily terrorized. Maybe that's what it is. They're certainly terrorizing the population. In a recent poll in the UK, 50% of the people said they wanted a lockdown. They thought it was a good thing. They were happy to wear masks. And I don't know if it's a fair poll, but I can testify that everywhere I go, I hear that neighbours are dobbing we say dobbing, but they're revealing to the authorities that somebody's having a party with more than 6 people. They're not wearing masks, and that's going on. People get on a train without a mask. I promise you, you will not make it to the next station before the police come on, because they will have told somebody or other, or telephone. There's a telephone number they can telephone, and I've seen people dragged off trains. So that's the sort of situation, a bit like the Stasi in East Germany, where you never knew who was going to report you. Anyway, as far as I'm concerned, it's all a scam by the pharmaceutical industry, and they just want us to enslave us with their pharmaceutical drugs. You try going to your doctor and saying, well, could you give me some vitamin D3? I can't afford anything because I'm out of work or whatever. But I've heard that D3 is better for my, to avoid it, rather than a flu vaccine. They will just laugh at you. They would laugh at you because even if they wanted to, they're just not allowed. They're also under the control of the pharmaceutical medical cartel. There's only a few countries that have avoided the lockdown. Sweden's one, actually, and they're doing pretty well. When they first had the lockdown, they made a few mistakes with protecting some of the at-risk people, but they soon resolved that, and now it just hardly exists in Sweden whatsoever. And the rest of the Western world is it in some sort of planned lockdown, house arrest, and to me, the first ones to submit to lockdown were Italy and Spain, and I say it's because they were ruled by fascist dictators in the lifetime of many of the elderly citizens, so they know what it's like. But of course, they particularly had high levels. I showed you on that list, I showed you high levels of vaccine for the flu. So that is a reason why they had so many deaths in the early days, actually. I'm not quite sure. The USA's had a lot of deaths, but somebody can tell me whether they... well, actually, I do know. I've been to the USA many times, and I've seen the pharmacists. They have big signs outside, come and get your free, either free or very low-cost flu shot. And so they do really push it. As soon as you walk into a shopping centre, there's signs there, get your flu shot, get your flu shot. So it's probably a high take up there. But even the police in many countries are siding with the pharmaceutical industry and the politicians against the public. In Australia, which I would have thought was a really civilized country, they've gone crazy. And in the UK, not so much in the USA. I think the police are just more under the control of the local people, as opposed to, the police in the UK and in the USA are under the control of the politicians. I wish we could actually vote for our local police chief, a local police chief. I don't mean somebody that's 30 miles away, and we can maybe get things better. But some of the media is waking up. I was mentioning this before, not the BBC, they're still the same old, but they of course take donations from Gates and Soros, so they're in league with them. But many parts of the media at least are starting to strongly wake up and shout loud. We have something called talk radio, which is all over the country, and a lot of the people on there are really starting to get angry with it all. So, pity doctors don't take the lead from the brave doctors, but of course the brave doctors are getting sacked, and the brave nurses are getting sacked when they stand up and talk about it. Anyway, as ever, at the bottom of my newsletter, I've got all the immune products that I recommend. Healthy people don't die of flu or coronavirus. Only at-risk unhealthy people, and they are the ones especially that need to build up their strength. People that have got high levels of vitamin D3 in studies, even though they're at risk, even though they've got coronavirus, even though they're in hospital, they have a double the survival rate of people that have got low vitamin D3. So even if you're an at-risk person, you still should be on high levels of D3. You can see all this in my books. You can download them, go scroll down, click on the link, and you can download my books, each book, whatever condition you've got, whether it's heart disease, lung disease, cancer, anything, see the plan and go through the whole plan. The more you do, the better it is. But if you haven't got the money, you can do some simple things. Even sodium bicarbonate in your drinking water, even getting as much skin to the sun as you can every time the sun's out is going to help. Even magnesium is going to help. There's so many different things. Anyway, sorry to rant at, it's so frustrating when I know that people that do follow the plan do recover. Anyway, I shall see you next week. I'll still be here unless they come and take me away. You never know. All right, goodbye.